morning everyone. Today I will be looking at critical appraisal of a systematic review and meta-analysis. This is a clinical scenario. The WHO, as part of its tuberculosis prevention and treatment program, wanted to invest a large sum of money in low and middle income countries to screen and treat subclinical tuberculosis, as these patients continue to harbor the active TB cycle and are a source of infection to all the other people. Before this, the WHO wanted to know the prevalence of subclinical tuberculosis in these countries. So they went ahead and did this study. This is the study of prevalence of subclinical pulmonary tuberculosis in adults in a community setting. So this is an individual participant data meta-analysis. Unlike our usual meta-analysis, which is a pooled analysis of all the various randomized control trials, in this study they have gone and obtained the data of each of the studies and pooled them and made them into a larger study. So we'll be using the AMSTAR 2 questionnaire to critically appraise it. Usually we use FAS for JAMA. Today we thought we'll try a new different one. So it has 16 questions. The first question is, did the research question and inclusion criteria for the review include the components of PICO? So this is not an RCT, so there is no intervention or a comparison group, but the population that they have included is the National Tuberculosis Prevalence Surveys. So the various surveys which have been done from 2007 to 2019 in collaboration with WHO, which have followed a fairly similar protocol and applied standardized methods for data collection. The outcome that they have assessed is subclinical tuberculosis. They have defined it as 3 different definitions. So many of these studies have followed different definitions. The first definition that they have looked at is no persistent cough. So that is tuberculosis with a positive sputum culture, but they did not have an accompanied persistent cough for 2 weeks or more before the date of screening. So that is definition 1. Definition 2 is there is no cough at all. So TB patients with sputum positive TB but did not have accompanying cough at all. Third was no symptoms at all. So TB patients with tuberculosis with a positive sputum culture but no accompanying cough, fever, night sweat, weight loss, chest pain or any of these symptoms throughout the duration. Second question is, did the report of the review contain an explicit statement that the review methods were established prior to the conduct of the review, and did the report justify any significant deviations from the protocol? They had a very detailed and set protocol as to how they were going to do. So they went through all the national surveys across this time period and collected all the studies which fit into the criteria and who had a standardized method of looking at the outcome. Did the review authors explain the selection of the study designs for inclusion? Yes, they did. This usually, ideally it is meant for RCTs and non-randomized non-randomized intervention studies, but our study also, they have explained clearly their inclusion criteria. Did the review authors use a comprehensive literature search strategy? So they should have searched at least 2 databases. Our study, they had searched Medline and MBase for original full-length articles published between 1990 and 2021. So the keywords they used were tuberculosis, prevalence, community survey, screening, subclinical and asymptomatic. Did the review authors perform a study selection in duplicate? So there were 2 people who requested for the study for the individual data, 2 separate people who requested for it. Did the review authors perform the data extraction in duplicate? No, only one of the 2 people compiled the entire data into one big format. Did the survey authors provide a list of excluded studies and justify the exclusion? Yes. This is the Prisma flow diagram. Initially, they screened about 34 studies. Of the 34 studies they screened, they had to exclude 2 studies, remaining 32 studies. Of the 32 studies, 19 also had to be removed, of which, because 13 of the authors did not respond, 4 studies did not provide a reason, 1 study could not share the data before their publication, and 1 study did not have administrative approval. So finally, we were left with 13 studies. Of the 13 studies, 1 study had to be excluded because the culture results were only available for the positive sputum smears. So 1 study also had to be excluded. Finally, we had 12 studies for case definition 1 and 2, which is no persistent cough or no cough, and only 4 studies for definition 3, which was no asymptomatic. So they have given a list of all the countries, all the studies, surveys from various countries. Here we see India, they had tried to obtain data from India, but they could not obtain it. But other countries like neighboring countries like Pakistan and all, they have included. So predominantly it is done in Asia and African countries. Did the review authors describe the included studies in adequate detail? Yes, they have described. So they have looked at the symptoms, symptomatology of all the patients across the 12 studies and the screening methods, what all they used. So culture methods, many of them have used NGIP, some of them have used LJ or GABA. They have looked at other factors also like smoking, HIV status. So they have described this in pretty detail. Did the review authors use a satisfactory technique for assessing the risk of bias in individual studies that were included in the review? They did not do that. They have said that ideally they should have gone through each of these studies and assessed the risk of bias and reported it prior to going ahead with the study, but they did not. So instead, what they did was they, of the 12 studies that were included in this study, in this meta-analysis, they calculated the mean proportion of subclinical tuberculosis and compared it with the other studies which they could not include in the meta-analysis, and they found them to be similar. If the meta-analysis was performed, did the review authors use appropriate methods for statistical combination of results? Instead of pooling the results, they pooled the data and they redone the analysis. This is the results of our study. So overall, they had 6,02,863 patients across all the studies together, of which 40% of these patients included were from Asia. Here we see that little bit more patients on the rural side had subclinical TB as compared to the urban side. Based on the cough status, 57% of them were women with subclinical TB, and patients who had cough for more than 2 weeks were 4.8%, and patients who had no cough were 82.2%. So if we look based on the chest X-ray alone, only 8.9% of them actually had a positive chest X-ray result, whereas 91% of them did not have any X-ray findings. Culture positivity was seen only in 0.3%. This is the data where they have divided the population into 6 categories based on negative chest X-ray and positive chest X-ray, and based on the duration of cough. No cough, cough, and cough for more than 2 weeks. Here we see that the proportion of patients with subclinical TB was maximum in patients with cough with more than 2 weeks and who had a positive chest X-ray finding. This is a substratified analysis across the various countries. So we see patients who had no cough. The proportion of patients with subclinical TB ranges from 27 to 83% across various countries, but the aggregate was 62.5%. Here we see it is a hierarchical regression results. So basically we see that men with TB are less likely to have subclinical TB in case definition 1 and 2. It is statistically significant. The only other thing which was close to being statistically significant was urban population with a confidence interval of 0.9 to 1.5 with an odds ratio of 1.2. But because it crossed 1, it is not statistically significant. This is a graph where they have seen patients with sputum smear screen, and here also we see patients who have positive maximum were patients with cough with more than 2 weeks and who had a positive chest X-ray finding. Going on, if the meta-analysis was performed, did the review authors assess the potential impact of the risk of bias in the individual studies on the results of the meta-analysis? No, like we mentioned earlier, the risk of bias was not addressed adequately. Did the review authors account for the risk of bias in individual studies when interpreting or discussing the results? They did not. Did the review authors provide a satisfactory explanation for and discussion of any heterogeneity observed in the results of the review? So heterogeneity is applicable only when we pull the results of the data and to see how heterogeneous our results are. Here, because they took the individual data, it is not applicable. If they performed quantitative synthesis, did the review authors carry out an adequate investigation of publication bias? In this paper, they had not mentioned anything regarding a publication bias. Did the review authors report any potential source of conflict of interest? They had reported that there was no conflict of interest with the funding, with the funder. So going back to our clinical scenario, we see that the prevalence of subclinical TB depends on how we define it. So based on our definition, whether we define it as no cough, no persistent cough, or no cough, or no symptoms at all, it will vary across our population.
Yeah, let's give Christina a hand, please. Thank you, Christina.